Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to know how to manage chronic low back pain in athletes, what you're missing, and what to do to change your approach, you need to tune into this episode. Before I go into the podcast, what is new? What's better? This was, for those who've been following my podcast, this is the first weekend in I think 4 weeks that I've actually been home. It's been absolute chaos in the best way possible, just traveling a lot. Last week, I mentioned on my podcast, I was in Austin. The week before that, I had a big, I think, a big conference in Florida. And the week before that, I was in, I think, Florida again. In other case, there's just been a lot of moving parts, and it feels good to be home with my family. Like you get that you're like, I just want to be home in my bed with no other things. I want like my comfort food. I want my couch. I want my mattress. I want my kids. So that is what is new with me. Simplicity, consistency is where I want to be at the moment. So good to be back in the gym. My kids are doing great. My son Zach, gosh, if you've been listening to this podcast, my son, I love this kid. He is a very emotionally intelligent human being. He reads body language. He reads facial expressions. It's something actually we've been working on quite a bit. And to see him thrive on it, he's a 7-year-old and he watches people's faces and eye contact. Everything that I teach you guys in this podcast is what I work with him on. Just how to be a good person, how to recognize when people need help, how to identify those things, those little nuances, the intangibles. And he did it to my wife recently. He said, I guess she was working on some things, was a little frustrated with homework. And he said, Mom, it looks like you need a hug. Do you mind if I hug you? And she was like, actually, that's exactly what I need. And so it's cool to watch. It's cool to watch him grow up into that and really being able to identify that. Because even my wife says, she goes, that boy at his age it's tough because I don't feel like I had that as a kid. So awesome seeing him doing that, and hopefully he's teaching his younger brother Jacob, who is a menace at the moment, and my daughter is doing amazing. All right, on to this podcast. Chronic low back pain. So the reason I'm doing this podcast is because I recently just went over a complex case with my team, and I think it's very important for you to understand how to manage these cases. And I think you can go down a rabbit hole of the best exercise, the best framework, the best belt, the best strategy, the best hip hinging movement. There's so many layers, and what I want to be able to do is break this down into small chunks and small pieces so you can understand and improve your framework on how to outline, okay, what at this point, this is what I would do. I would throw in an external support device at this point, and I would work on strengthening at this point, or at this point, I would do this. And it helps kind of streamline your process. So if you're a clinician who's been frustrated with low back pain and being able to manage it, and you're like, "God, what am I missing?" This is the episode for you. This is the one that'll help you kind of figure out what stages you need to be adding things in or what is missing inside your approach so that you can be successful in the clinic. So I titled it chronic low back pain because I think the majority of us can tackle back pain. I think like, oh man, I can fix something that's been hurting for 2 3 months. That's not a problem. But I'm talking about something very complex, and I'll give you a case. And Not all of these come along your way, but if you know how to manage tough cases, easy cases, or even easier. So my job today is really to describe something super complex, maybe you might not see, or maybe you might see often, and how do you make that a little smoother? I'm gonna give you a case. You've got a 25-year-old female with chronic low back pain, 5-year history. Okay, let's say 5-year history. So they were 20 years old when they got it, and they were playing college soccer at the time, and it was an insidious onset, just a high level of play, D3 soccer, and they started having symptoms, kind of saddle paresthesia. What is it? that that irritates them. It's kind of a glute paresthesia. It gets more complicated because they have excuse me, they have PSIS pain. So you're like, okay, well, maybe there's some sacroiliac in that. And they have pain with lumbar extension. So I'll give you the past medical history and the surgical history, injections, all those things. And you might find yourself lost inside this. Like, what do I attack first? And all of you are going to have different approaches. And I'm going to lay this out for you and what to simplify. MRI at 22, so 2 years in, has had injections and has not had surgery, has been on pain medications, and has been frustrated, has tried physical therapy, multiple bouts, has tried massage, has tried chiropractic, has tried acupuncture, has even tried prolotherapy for the PSIS pain. And so that was an over course of 5 years. So 2 year history of pain before an injection, and MRI within 2 years as well. So MRI and injection, no surgery, and their goal is to avoid surgery. So now they're done with college soccer. They continue to be active. They play weekend, like intramural soccer, and they enjoy just being active at the gym. They exercise twice a week and play recreational soccer 1 time a week. So 2 times at the gym, 1 time playing soccer, and they have 3 days of activity. 25-year-old, fairly fit, active, not super strong, and hyper mobile of the PSIS and with lumbar flexion. They're hyper mobile. They can touch their palms to the ground. So you have an interesting case. So it sounds like a little bit of instability, and now you're thinking, okay, so they've had this for 5 years. They've had an injection, no success. They've had radiographs and they've had MRI, no CT scan, no surgery, and they want to stay away from that. And a prolotherapy, about, I think, 2 injections over the course of 6 months with no improvement. So what are we doing here? Where's the pain? All right, so the pain is localized on the L45 region and at the PSSIS, and they stand for a living. They work at a bank and they're a teller. They stand, and that what gives them a lot of pain. And what helps relieve that is sitting. Believe it or not, sitting does the trick. It helps them. So they have pain when they're lying down. They sleep on their side or their back. That hurts them. They stand for a living, and that also hurts them too. So, with a 5 year history, that's why I labeled it chronic low back pain. I think, and in athletes, right? Somebody who's active, who enjoys being active, who was a collegiate soccer player, so they're athletic, they have some form of training history. So, and they're motivated. They want to get rid of this pain. So you're like, okay, cool. So, like, what would I do? The question is, what has been done before? So they've gone to physical therapy. They've done multiple bouts of strengthening, core strengthening, hip mobility, ankle, and stretching, and all these other things. And they've tried McKenzie, that didn't work. Well, after they got another MRI, they found a spondylolisthesis, I think at L45, and it's pretty significant. And so every time they are in a certain posture, that gives them, pain. So when they go into extension, that's really the driver of it. That's been the history. So this patient, this athlete, wants to be able to, like, just function in life, right? They're not trying to, run a marathon. They just want to be able to have no pain throughout the day. So let me give you some more complexity around this, in that this patient here, there's some psychosocial factors you have to consider. They definitely display fear avoidance, right? They've had this for 5 years, and now it controls them quite a bit. They have quite a bit of high tone in their abdominals, like they don't want to relax. And you've met those people, high stress, like you test their reflexes and you can't even get a patellar reflex just because their nervous system is always on. So you have to distract them and try different things. And this is that person. This is a person who has they're a little bit more anxious, they're high tone. And per their report, they didn't used to be like this, but they're so worked up about this pain. So what do you do to manage cases like this? what's the secret sauce? Like what are you missing and everything else? So there's three ways to approach any case, and if you listen to my podcast, you've heard flavors of this, and I want to reiterate because it's very critical for you to approach any athlete with kind of the same process. There's three ways. There are three levels on how you approach an individual, right? So one is at the principal level. Principal level just means why are they seeking help? Like, why do they want this so bad? Like, what is the purpose of them being here, right? And this person just wants a quality of life adjustment, right? They're not returning to play. So that helps understand how I'm going to approach this individual, right? Like, they don't have a timeline. They're not trying to get to a game. They don't want to get back to sport. They truly just want to have a healthier lifestyle. So that is why they're here and what their general approach is. So then the next question is that's a principle level. The second one is a strategy. Okay, so if you know that you want to be able to help them get back to just having a healthy life, how does your approach change compared to somebody who's going back to sport? There's no urgency. What is it that you need to do on like your level of intensity in terms of how you approach your strength program or how you approach their flexibility or their mobility routine? How busy are they? How do you need to adjust it? So now you have the true understanding of why they're here at the principal level. Strategy is now adjusted to their needs, their wants, their like daily life, their fitness life, their career, their jobs. And then the last piece, so we went principle is the why, and strategy is the how. And the last one is the tactical level, which is what are you going to do, right? So this is the exercise, this is the McKenzie, this is the manual therapy, this is the belt, this is the ice, the compression, the modalities. This is like the tactical, like what am I doing to help this person? And so anytime that you are navigating a case, step back a little bit and understand like why are they here? What am I truly helping them do? Like why am I doing this? What is the purpose of me helping them? And then now that sets the tone on how aggressive or conservative you're going to be along this approach. So for this individual, let's put it in context. What do they want to get back to? A healthier quality of life with no timeline. They just want to have less pain. Sounds good. All right. How does that change my strategy? Well, they sit for a living. They only exercise 3 times a week. So I know I can make some adjustments there. They stand 8 hours a day. There's some adjustments I can do there. And there's some fear avoidance. So I got to be careful on how I approach this. Do I want to go full force in? Do I want to do 5 days a week? Do I want to do 3 days a week? What's my recommendation? What's my plan of care? And then how often are I making adjustments? Am I making adjustments to their program and their corrective exercise every day, every session, every week, every month? Are they going to be compliant? What's their fear avoidance like? What's their motivation? And for them, if somebody's fear avoidant, now you have to consider like you don't want to make too many adjustments. You want to create a course, give them the confidence and set the tone, and then make readjustments intermittently, but not consistently, not every single session, because there's not a timeline. You need things to marinate so they can actually get comfortable with it. They can get confident with it and believe that you're doing that. And you make adjustments based on how they're improving. Next is what am I doing? What are we doing to this individual? So they've tried the manual therapy and they actually don't like manual therapy. Great. Now, all you manual therapists out there are like, shoot, what am I going to do next? What do I do with this person? Because I'm right there with you. I enjoy the manual therapy. I rely heavily on my hands. And sometimes when people don't enjoy that, I can't force that, right? I'm not going to do that. So manual therapy's out. So this has to be more motor control, more neuro re-ed, those type of things. So it's going to be a lot of education, a lot of re-ed. So why are we doing that? Healthier lifestyle. How am I approaching it? Conservatively with longer bouts of program with small changes intermittently. And from a neuromuscular control focus, that's my thing because they don't like the manual therapy. So that sets the tone for how I'm going to approach this person with a complex chronic low back pain case. Everything I do is inside that framework or inside that shell. And this is where a lot of physical therapists like yourself will get lost. We get lost in the weeds. We go straight to the back pain. We're like, all right, cool. You go straight to the manual. That didn't work. They don't like that. Great. So you go straight to the correctives. Well, they're not being compliant. And you make adjustments every single session because you're like, that's not working. Let's make another adjustment over here. Okay, great. That's not working. Let's extend them out a little bit more and say, let's see you next week. And we'll only make a little bit of adjustments. That's not working. So you're constantly making those just adjustments. And the problem is that some of those things might be working. They just need a little bit more time. And now that's with this case that's a little bit more complex and chronic. I'm setting the tone for the chronic people. These individuals do better with this type of framework. Now, let me contrast that with somebody who is an athlete and competes in 2 weeks. Well, you're making adjustments every single session on the fly, right there and then. You're going aggressive. You've got it fully controlled, and because you have a timeline, like that's a whole different person, right? That's complete opposite what we're talking about now. If you had endless time on somebody with fear avoidance who doesn't feel comfortable or confident moving, how do you adjust for that? You don't make changes very rapidly because they're going to be concerned. So you spread this out. Now that may make sense to you, but in reality, you don't take a step back in your clinical practice. How many times have you been guilty of, getting finished with one person on the table who competes in soccer in like 3 weeks, and you're so excited about their progress. And you have a post-op who's returning to play in the next 2 weeks, and like they're completing all their hop testing, they're getting back to sport, and then you have this chronic person. You come with that same energy. They come with the changing of the frequency and the correctives and all these other things, and that person just like doesn't seem to get better. And like they ruin your flow, right? You just had two great athletes, good patients who are active, and you have this person who's just slowing down your progress. You're like, I'm doing the things right. And one of those things you can see right now is that you might be changing it too frequently or changing it too often. And so now we take this global approach. All right, what are we missing here? Let's take this a little slower. All right, so here's how I lay out this framework. What you're going to do is you're going to make 4-week blocks, right? So this person here is not training as often. As I mentioned, they're not super muscular, but they're active. And so because they were 22 at the time of injection plus MRI and the workup, they started to decrease their activity level. They used to train 5, 6 days a week in college sports, D3. Now, when you come from that activity level down to 3, you and I both know, like, that feels horrible. Like, you know what that feels like. Gosh, that's like feeling sick and then trying to go to the gym. Like, maybe you exercise 5 days a week, and then now when you're sick, you only train like once or twice, and you couldn't get in that week. How much does that even hurt your immune system? Does that hurt for your confidence, like your ability to just get things done? Exercising fuels you, right? And so people with fear avoidance, they don't think like that. What they think of is, if I move less, I have less pain. And that's real. You have to get that. You have to understand that first. If I move less, I have less pain. So you go to this spiral, this wormhole of, if I continue to move at this rate, I'm actually getting better. Well, what you know is that they're losing muscle, so they have atrophy. You know that they are becoming deconditioned, and they're unable to manage the applied stress over time now. So the minute they pick something up, the minute that they add a load to their back, they carry a baby, they do something, that applied stress is now over and above what they're currently used to. So it's all about what their baseline is currently. So her previous baseline was much higher. Now she's coming down to below ideal baseline. So what do you do in these individuals? Well, from a principle level, we know what we're doing. Our strategy level is we got to spread things out, don't change things too much. And the tactical level is, all right, great. So now that you're making these adjustments, you know you have to make smaller changes. So it's all about your approach here. The biggest thing on these individuals, especially with this type of a case, you got to treat them like true athletes. Think about this. Are they in season, postseason, preseason, off season? This individual is definitely not in season because their baseline of fitness is so low. They haven't been active. So you got to treat them like they're in off season. These people haven't been able to move. So before you start adding exercise, you and I know they have to be able to handle more stress. They need to be able to have applied load over time and be able to respond to that. And their body right now says new stimulus equals pain, more movement equals pain. So now we have to start a very low level general preparation phase in the world of strength and conditioning. That's what we refer to it as, a general preparation phase, a foundational phase. And you and I know that it takes 4 to 6 weeks for an adaptation process to handle. So what we're going to do is for 4 to 6 weeks, just create an increase in their current baseline level of fitness and or strength. So if their current level of fitness is 3, we're now going to add one more day, just small tweaks, right? So We're going to add a fourth day for 4 to 6 weeks, monitor and see how they feel. Now, your goal here is to increase their stress and have an actual, like, calculated response to progressive overload. So now you have to look at, all right, all these great exercises at the tactical level haven't been helping. Let me take a step back. I need to build a little bit more resilience on you. Let's add a little bit more of a neural re-ed structure to you. So let's go on a general preparation, neuromuscular control, 4 to 6 weeks, add an additional day of exercise that includes your 2 to 3 corrective exercises built in that. So now they can adapt and have applied stress. So they're going to see you twice a week to review their program to ensure that the numbers are right, with the overlying arching goal at 4 to 6 weeks that they're stronger than they did previously. Meaning, the way you're going to adjust for that is, can you stand longer than 8 hours? Can you do 8 hours with less pain, right? Can you play soccer with less pain? Are you able to get 4 days of exercises with reduced pain? What are you now able to tolerate that you weren't able to before in 6 weeks? That's my marker of success. That's your key performance indicator. So once you've locked that in, now you have an idea. Okay, great. Functionally, they are improving, even though their pain has not gone away and they're still 5 out of 10. You now have done more. So functionally, they've been able to do more, applied more stress with the same amount of pain, which means that they now have adapted and they're able to have more resilience. So once you've built that general preparation phase, your next step is great. You've been able to tolerate that. Now let's build some strength on that. So now you can increase your load progressively, nice and easy. You can keep your 4 day a week. Now, this is where you're going to build true strength. You're going to allow that person's back muscles, hip muscles to be able to tolerate the load. The first 4 to 6 was just so they can respond to more stress. They've proven it. They're able to keep a 5 out of 10 with an increased day. That's incredible. Functionally, I'll take that all day. The next step is, can we build a stronger base? The first part was can you build the endurance? We proved that. Great. Let's build that strength. Now let's up the ante and increase your load and decrease the reps. Why? Because we want your back stronger, your hips to be able to tolerate this, whether you're carrying a kid, you're doing groceries, you're doing whatever it is that you do. So that way, when you take a tackle while playing soccer, that your body responds to it and says, don't worry, I've handled this before. So you build another 4 to 6 week block of strengthening while you work on the correctives. This is where you can, if you've for the first 4 to 6 weeks have built that trust, they understanding it, you can go to 1 time a week now for the 4 to 6 weeks if they are understanding the movement, they are understanding the progressive overload, and especially if they don't like manual therapy. Your goal here is neuromuscular control. Your goal here is accountability. Your goal here is education. That is your premise. That's the whole thing that you're locked into, not just pain relief, but how helping them get out of pain and staying out of there. So you're going to build a 4 to 6 week block of strength. Once you've done that, your measure is you've now added progressive overload. You can handle more weight at 4 days a week, and your pain has stayed the same or gone down. That is successful in anybody's book. Why? Because if you've had pain for 5 years, there's no way you're going to be pain free in a short amount of time. So if you understand that, your next goal is, can I help you do more with actually the same amount of pain or less? Once you've built that endurance block, that general preparation phase, you built the strength. Let's build a little bit of hypertrophy. Let's get the glutes strong. Let's get everything else stronger. Now, if you are in an urgent phase where you don't have this time, you can skip the hypertrophy component. But for most people, this is a big deal, and all you're doing is you're lessening the load, increasing the tempo, decreasing the weight, and this allows them to build a little bit more mass. How many people have you seen with, like, no erector spinae? They have no glutes, they have no quads, and they have good movement and they're hypermobile, but they have nothing to resist stress. And that's their time to build a little bit of muscle mass to be a little bit more resilient. So once you start building this pyramid, think about this, right? Somebody who's had chronic pain has been deconditioned. For this person is 5 years of deconditioning, 3 years of doing minimal and dropping their intensity. How can you expect that a couple exercises would override 3 years or 5 years history of pain. It's just not possible. Like, no matter how good of a physical therapist you are, yeah, you got their pain down just for a little bit, but what did you do to really regain their function, mobility, and everything else that took 5 years? There's no way in 8 weeks that you can conquer 5 years, not even possible, especially if it's chronic. And this is where you have probably gotten stuck. You've been frustrated. You're like, what am I missing with these back pain patients? Like, I don't understand. Like, my 8 week like progress, my 8 week sessions have been able to at least get them some improvements. And I think the question is, what level of improvement are you looking for? I think it'd be very difficult to reduce their pain, especially if they have fear avoidance. They're concerned about, their quality of life, and they have high tone. You're not going to change that tone. I think you have to let them see that. You have to get them exposed to those loads, exposed to those resistance and stresses, so that they can calm down and be at ease. If you're really looking at creating independence and creating meaningful, impactful life outcomes, you have to take this approach of, what am I doing here? Let me take a step back. Let me create something, make smaller adjustments on these individuals, because there's no way you'll change high tone, no way you'll change depression, anxiety, fear avoidance. There's no way you'll do that in 8 weeks. And they just have to know that you're here for the right reason. You're here to give them support. You're here for the accountability. You're creating these things for them. And people with chronic low back pain, this is what they need, because no one else has done this. Think about this. You've probably been that clinician who who is piecemealing a lot of shit, a lot of crap. And what I mean by that is, their neurosurgeon or their like primary care physician says, "Hey, this is what you need to do. You need to do these McKenzie exercises," which hurt them because they don't like the extension. Perfect. So you got that, and then you have a personal trainer saying, "Hey, I think you need to stretch more. We're going to stretch you at these sessions." And they have their spouse who's googling like, "Hey, this is the magical like balm that you have to put on your low back, and it's a pomade or whatever it is that you put on your back, and this is the synthetic CBD cream that I really saw on a commercial, and this is really what's going to help you." And then you have a family member who like, "Oh, I used to have that back pain. Here's some high level pain medication." So this person is being exposed to all these levels of treatment. And can you imagine what that feels like? And thinking like, 25 years old, this back pain is controlling me. Out of all these people, who do I trust? Who's right? And no one is synthesizing that into one big plan. And that's your role. Like, my goal here on this planet is to help physical therapists understand that you're not just a physical therapist. You are a healthcare provider whose job is to synthesize the primary care, the massage, the PT, the chiro, the acu, the athletic trainer on the field, the nutritionist or dietitian. Like, your job, you probably spend the most amount of time compared to all of those disciplines with one person in a given time slot. And that's where you can have the most impact. So if you use it just to provide exercises, it puts you in a position where you're not maximizing that outcome. You're understanding, like, listen, this has been 5 years. I know your primary care is telling you this. I know your massage therapist is telling you this. I know this. We're going to take that all in. And here's what we're going to do. We're going to combine all those things, and we're actually going to segment them in stages. So for the first 4 to 6 weeks, I'll let you continue with the massage. We're going to still stay with your pain medications, because I think that's going to help you get comfortable with overriding this stress. Now, what I'm also going to do is, I'm going to give you pain medications. I'm going to put you on an SI belt to lock you in, so that way you can trust this process and get you this in general preparation phase. Perfect. At the end of the 6 weeks, we're going to start to wean you and cut your pills in half. I'm also going to wean you from your belt, so you're doing it only 3 days a week. Perfect. Once you get into the strengthening phase, you shouldn't actually need this any more than you're used to. So we're going to wean your belt down. We're going to wean your medications, and this will give you a chance to actually improve your fitness and challenge yourself. This is where you need me the most, when you get into that strength phase, because that's when all the pain, all the things that you're dependent on, that's where that's going to start to drop. And once you understand that, your role now is, the biggest part is in that strength phase. Can they hit that new elevator? Can they hit that new hill with confidence? And that's your role, right? So that's where you're building out some programs. You're understanding truly why you're doing this for them. You're segmenting out into stages so you can apply all of those things. People always ask, "Chris, should I do this or this? Should I do more strengthening, or should I do a belt? Should I do pain medications? Should I do stretching?" It's not a matter of or, it's a matter of and. How do you do all those things within uh, a planned sequence of events, so that they're successful throughout the whole process? So change your mindset from, do I do this or this? How about you do them both and utilize this into a structured approach? How do you include them all so that way you're actually getting something from that, and you're actually not saying, well, I don't do these things because I don't believe in those. I don't believe in these stretches. I don't believe in this hip hinging. I don't believe in this. Why can't you do it all and provide a comprehensive approach? And when you don't do it all, you are not giving that person a fair chance. How many people have you treated? You're like, I don't do those type of approaches. I don't do modalities. You know, how many people that you probably needed to do that just so they can get over the psychosocial factor, they can get over the fear avoidance. That like that would be your one buy-in, but no, because you're stubborn and all your colleagues would judge you. You messed up somebody's life. You wanted to hold on to your principles and they didn't get the outcome they wanted. Why? All just because you don't believe in that? Give them a chance. Let them know their options. Give them like, hey, this belt would be good for you. I personally wouldn't use it, but I think it would be good for you at this current stage. I don't want it I don't want you to get used to it. I don't like ice, but if that's going to get you over the hill, then that's perfect. That's good for phase two. As we strengthen you, you're going to have some flare ups. I know that. So you can use the ice, you can use a little bit of the half of the pain pills. That allows them to be in sequence. Like they now have structure to the process and they can add things throughout that thing. And so, as I mentioned in my previous podcast, if you're like a chef, you're always adding in like little spices here and there. And so when you add spices, that's the art, right? So you're piecemealing all this person's like shit, all this stuff that they're putting up with. And your job is to synthesize that into a plan. And that's what they need from you. You are the head chef, you are the healthcare provider. And chronic low back pain is my favorite, purely for this reason, because I like when other people have made mistakes. So if I see a patient of yours who, has been struggling, and you maybe had another way, another approach, a very like narrow focused approach, or maybe when you were a new clinician and you messed up a couple times, and we've all been there. And if I took that same patient and I said, oh, great, so he went to see you, and your name is Derek. He went to see Derek, and Derek gave you repeated extension, stabilization, and told you to hold off on exercising for 6 weeks, take your pain meds, and then we'll reassess week to week, or session by session. That to me, I can take that and say, okay, well, that didn't work. So that was too close together. Let me see. Maybe repeated extension is not good. How about we add in exercise while they're doing this course of care? Let me add that in. Well, I worked with a personal trainer and that didn't work out for me. Okay, great. That didn't work. So when you have people who are chronic pain, it's great because they've already you can piecemeal more stuff. And when you have people who've never seen a physical therapist before, never seen anybody else, those are the hardest cases. Why? Because you're the person who's setting the template. You're the person setting the tone. You're like the oh shit guy because you like add in hip bridges and they're like that hurt. You're like oh shit, and then you add in hip hinging with a single leg RDL and that flared them up. Oh shit, and then you put in low back squatting and that flares them up. You're like oh shit. You're the oh shit guy, and that's a hard thing to be part of as you navigate patient cases. And so when everybody's done the "aw shit" for you, like, your job is like, "Oh, that's easy." There's a big difference between the 2, and I love chronic low back pain, I love chronic anything, because you get to put the pieces of the puzzle together easier, faster, and simpler, and your outcomes are robust because this person has been seeking help, and all I did was, especially if they're fear avoidant and they don't like manual therapy, the easiest thing to do is, like, you're just planning, that's all you're doing, and I think that's frustrating for a lot of physical therapists because we rely on our hands, we rely on the immediate gratification of like creating an outcome right after a test. You need a comparable sign, but if there's no comparable sign and they're spaced out between sessions, or you don't see that comparable sign until a month from now, that's delayed gratification. And we as clinicians don't like that. We're like, I want to know I'm doing great. I want to know I'm doing great. And to sit back and just let the process handle itself, you know that the thing makes sense. Your KPIs are strong, your key performance indicators are strong, and you're looking at function, you're distancing this out. So this is a delayed gratification, a lot of planning, and it helps you put yourself in a position of, oh my gosh, like what if I can't use my hands? What if I only had to use my brain? Like, how does this work? And that's scary for a lot of clinicians because you depend on that, right? That's what tells you that you're on the right track. So if you don't love chronic back pain, it's probably because of your approach, not your skill set. It's not that your hands aren't great. It's not that your exercises aren't great. I think you take a step back. I mentioned there's three ways to approach this: the principle level, while you're doing this, strategy level of how you're going to approach this, and the tactical level of what you're going to do in every session to accomplish it. And so PTs think tactical first. That's the first thing we talked about, right? If I presented that person that you were licking your lips, you were salivating, like, oh my gosh, I would totally do the manual work. I'd work on the erectors, I'd open up the hips, I would do this random opener sequence to this hip and open up and do the myofascial lines and blah, blah, blah. And I was like, what if this person doesn't like manual work? And what if that failed before? You're like, oh shit. So yeah, put yourself in that position. The last three things that you do to help people is three things. Primarily two are heavy hitters. Um, Number one, you're an educator. By and large, you like that is your jam. You are an educator through and through. That's your job. Number two is you're an accountability specialist. Your job is to make sure that people don't do it. Why do you think that people? Why do we think we have a job? It's because people don't do it on their own. You mean to tell me they don't know how to do it? You can Google and find templates and go on Instagram and buy a, I don't know, nowadays $4.99 template for rehab at home with this fitness specialist, or this PT is now selling a 4-week program on how to manage your chronic low back pain. Do it your own yourself. The reason why people come to see us is because even if you gave them all the resources, they still don't know how to put it together. Well, what happens if I flare up? Is this the right exercise? Do I add this now? If it keeps flaring me up, what do I do now? That's your job, right? Like, you are an educator first and foremost. You're going to provide that program, and then you're an accountability specialist. You're like, listen, at week two, you've been doing great. Let's keep you stay the course. Let's move this way. You're constantly making adjustments. So, as an educator and accountability, your job is to provide the education and then just kind of sit back, relax, and make some adjustments here and there. And the last one is motivation. Some people come to you because they know what to do. They use all of it, but they feed off your energy, like they truly do, right? For some of you in the clinic, like that's, these patients, like they just love your energy. You're positive. You're exercising. You like love life, and they want to be like you. And that's hard for some clinicians to understand. They don't come here just to get out of pain. They come here for your energy. They come here to make sure that they're on the right track. They come here because your education. I had a patient, I think 2 days ago, say, it's kind of addicting. I love being around my PT. I love being around them. They educate me. They teach me how to put it together, and they're just good energy. I feel like I've never felt that before. And somewhere inside that, you find yourself. And so if you have complex people, just know that they're probably coming to you for those three things. They want the education 100%, but other people, they can find it on their own, but they just don't know how to piece it together. That's why you're giving them accountability. And sometimes they're there for your energy. So don't think that it's always about the tactical small things that you do for them. It's helping them put it together, and man, feeding off of your positivity, because that's what motivates them to get better. And so if you struggle with back pain, it's probably because you were focusing so heavily on those small little details that you just need to take a step back. What am I doing for this person? Why is that so important? Because your outcomes are dependent on that. And so if you find yourself not getting the outcomes you want, it's probably because you've lost a little bit of sight of truly what matters. So there you have it. And if you're looking to be able to put this together, there's two places to start. You've been listening to my podcast for a while. You need to start joining my Sports PT Academy. This is where I'll help you put this together. I'll help you figure out, is it that you're going left when you should be going right? Where do you need the accountability? Where do you need the kick in the pants? You're the same as the patient, right? Like, don't think because you can get all this information on what to do, you can read all the research articles. The struggle you have is that you just don't know how to put it together at the right time. Well, what about this case? Well, what about this case? You just need better frameworks. You just need to know. You don't need more myofascial lines. You don't need more glute exercise. You don't need more single leg RDLs. You don't need more rotator cuff strength. That you have enough at this point. It's, what do I need to do to put it together a little bit more seamlessly? I don't get those outcomes consistently. I don't know what to do with these types of patients. If you're having that level of trouble, I don't know what to do with these type of patients. That's where you need the most amount of help, and that's where I can help. I'm inside my academy. If you're new to my world, don't start at my academy. I wouldn't do that. Take a little time to take any of my courses, and probably this upcoming course is the best one for you. If you're new to my world, that's the Sports PT Kickstarter. It's an overview. It's a crash course, 8-week online course with me, live with me online. To be able to navigate everything sports PT, all domains. I think it's 8 domains of sports PT, and it helps you from on the field to be in the clinic to be in the gym, how to work with athletes across, what to do with chronicity, what to do with sports rehab, what return to play guidelines, everything that you want, that you feel like you like, I just need a little more exposure in that. The Kickstarter is perfect for you. So there you have it, multiple options for you to be able to navigate these things, both for chronic pain and then wherever you are for your professional development. So I hope life is amazing. You guys are crushing it and enjoying every aspect of life. I will see you guys on the next episode. Take care.